Welcome to this video on diabetes, where we will do an overview with a specific focus on its impact on cardiovascular disease. We will begin with a brief overview of the disease, including its definition and its place in the socioeconomic context, highlighting its epidemiology. We will then take a deeper look into the biochemistry and pathogenesis of diabetes mellitus, gaining a better understanding of how the disease affects the hormonal feedback loops in our body. Lastly, we will delve into the relationship between diabetes mellitus and cardiovascular disease, giving a bit of a background of computational tools that can allow us to unveil this relationship. Diabetes is a metabolic disorder characterized by high levels of sugar, resulting from defects in insulin secretion, insulin action, or both. The elevated blood sugar levels cause disturbance of fat, carbohydrates, and protein metabolism, which alters the body's energy utilization, affecting its functioning. The chronic hyperglycemia or high blood sugar can over time result in a number of health complications, with long-term damage, dysfunction, and failure of different organs, especially the heart, eyes, blood vessels, nerves, and kidneys. Diabetes mellitus is one of the most common forms of chronic diseases, affecting individuals from all ethnic groups globally. As of 2014, it was estimated that 422 million individuals worldwide were suffering from this disease, with type 2 diabetes accounting for the majority of cases. There were an estimated 1.5 million fatalities attributed to this chronic disease in 2012. Now, let's take a deeper look into diabetes. We know that diabetes leads to high levels of glucose in the blood, and that this is caused by the body's malfunction in insulin secretion, insulin action, or both. But how does this actually work? Firstly, we need to know that the pancreas secretes two hormones in charge of the regulation of blood sugar: glucagon and insulin. Glucagon stimulates glycogen breakdown in the liver, leading to a release of glucose into the bloodstream, increasing blood sugar levels. Insulin, on the other hand, does the opposite effect by stimulating glycogen formation at the liver, reducing the glucose released into the bloodstream, and additionally insulin promotes the uptake of glucose into the cells, which overall reduce the glucose in the bloodstream. All in all, both insulin and glucagon help to regulate blood sugar levels, maintaining glucose homeostasis. So, if the secretion of the insulin is faulty, it makes sense that we're going to see less glucose being moved to the cells, hence more glucose in our blood. Now, glucose is of paramount importance since it is one of our primary sources of energy. So, if our cells do not have access for it, this will disrupt our entire system's functioning. For example, if the metabolism of lipids and proteins is altered by diabetes, in the absence of adequate glucose utilization, the body will turn to other sources of energy, such as fats and proteins, leading to the production of ketone bodies, which can be toxic at high levels. This is known as diabetic ketoacidosis. There are two main types of diabetes: diabetes type 1 and diabetes type 2. And the main difference between them is the mechanism that leads to the glucose levels to rise. Type 1 diabetes is an autoimmune disease that occurs when the body's immune system attacks and destroys the insulin-producing beta cells in the pancreas, leading to a rupture of the hormonal feedback system we saw previously. Type 2 diabetes, on the other hand, is a metabolic disorder that occurs when the bodies become resistant to insulin, or when the pancreas cannot produce enough insulin to keep up with the body's needs. So, what causes type 1 diabetes mellitus? There are a number of factors involved in its occurrence: genetic susceptibility, immunologic dysregulation. Others point at environmental factors, with environmental chemicals influencing the immune system and therefore increasing the risk. And others even point at nutritional factors, such as bovine insulin in cow's milk, or the risk being reduced by prolonging breastfeeding. So, what other factors are associated with increased risk of type 2 diabetes mellitus? These are sedentary changes, obesity, age, gestational diabetes, PCOS, hypertension, ethnicity, dyslipidemia, family history, and metabolic syndromes. I want to especially highlight the dietary factors involved in the increase of risk, which are increased fat intake, increased intake of red and processed meats, the consumption of fried foods, the increased intake of white rice, and the intake of sugar-sweetened beverages. Symptoms of diabetes type 1 include excessive excretion of urine, polyuria, thirst, polydipsia, or constant hunger, vision changes, fatigue, and weight loss. It is important to note that these symptoms may occur suddenly. Symptoms of diabetes type 2 may be similar to those of type 1, but are often less marked. As a result, the disease may be diagnosed several years after onset, after complications have already arisen. Health impact comprises several concepts that we have talked about previously, such as increased heart attacks or strokes, reduced blood flow, neuropathy, or nerve damage. Type 1 diabetes must therefore be managed with lifelong treatment insulin, usually in the form of an injection, although an insulin pump is often seen these days. Type 2 diabetes is treated with medications with or without insulin, with metformin being the most common medicine for type 2 diabetes patients. The major effects of diabetes mellitus are microvascular and macrovascular complications. Microvascular complications affect the capillaries and arterioles in the retina, the kidney, and the nerves. These are caused by a long-term exposure to hyperglycemia. This condition damages the cell types that cannot downregulate glucose uptake, causing intracellular hyperglycemia. Microvascular complications are best prevented by strict metabolic control. Macrovascular complications affect the large blood vessels, such as those in the heart, brain, and legs. Especially, diabetes accounts for 75% to 95% of excess coronary artery disease risk and enhances the effects of other cardiovascular risk factors. The link between glucose control and cardiovascular disease is not as strong as that seen in microvascular complications in diabetes, which motivates the needs to better understand the interplay between diabetes and macrovascular complications. Now, for the last part of the video, I would like to briefly introduce you to the interplay between diabetes and cardiovascular disease, which is the area I'm currently researching at King's College London. Cardiovascular disease is the greatest long-term risk associated with diabetes. Early and timely diagnosis of CVD is essential for increasing the chances of successful treatment and prevention. Specific changes in cardiac morphology can be detectable even before any manifest heart disease develops. Therefore, finding these cardiac morphology markers can allow for early detection of the so-called diabetic cardiomyopathy. How does diabetes mellitus affect the heart? We know that left ventricular hypertrophy, or pathological thickening of the wall of the left ventricle, appears to be the main finding associated with diabetes mellitus. Additionally, diabetes mellitus has been shown to have effects on all chambers of the heart, causing a decrease in chamber size. There are several unknowns in terms of the effects that diabetes mellitus causes at different stages of disease progression. In general, the biggest question is whether the changes in cardiac morphology are due to aging or the occurrence of diabetes mellitus. This aspect is something that we are researching at King's College London, and we hope to gain more insights as we go through our study. Computational analysis techniques can allow us to better unveil anatomical markers like the ones before described. In my research project, we utilize computational atlases to provide a detailed representation and comparison of the structure of the heart from diabetic and non-diabetic patients. These are the references used for the making of this video. Thanks a lot for watching, and see you in the next one.